ahead and give you your medications, but today the doctor has prescribed metformin. Hi. Oh, yes?
Hey Haley, your patient in room 355 is asking for help.
Okay.
He says his calf started to hurt. When I checked it was swelling.
Okay, I'll be right over. That sounds kind of urgent. So, it says take one. I'll just give it to you through your IV line. I'll just crush it up. Okay, and I'm just gonna put it here. Okay, now that we got that out the way, I'll be back in 15 minutes to check, okay? And I'll just leave this here. I trust you that you will take care. Time to go check on Mr. Chicas. Let's go see how he's doing. Oh my gosh, Mr. Chicas, are you okay?
Obviously, there are a lot of errors here. Let's talk about medication errors and how to prevent them.
Hi, my name is Haley, and in this video, I'm going to be helping you understand what medication errors are. So we're going to start off by talking about the definition of a medication error, why they're so important, and then we'll move on to how we can prevent them. As defined by the National Library of Medicine, a medication error is a failure in the treatment process that leads to or has the potential to lead to harm to the patient. Keep in mind that these errors can occur at any time and moment in the medication process, from it being prescribed to the preparation of the medication to administering the drug. Let's put a scenario in our heads. Imagine it's a noisy day at the hospital and you call the doctor requesting Tramadol for pain for your patient because they're having trouble sleeping. And later you see in the EMR that the doctor has put Trazodone, which is a sleep or depression medication. You think nothing of it because the doctor must be right. So you give it to your patient, and when you return 15 to 30 minutes later, you find them anaphylactic because they had an allergic reaction to the Trazodone. Thankfully, they were okay, but what did we learn, and why are medication errors so important? Well, for one, we did learn that we always have to double check what is the medication that we're giving. And number two, why are medication errors so important? Well, for reasons like that, patients could have allergic reactions or get seriously harmed or even die. So how can we keep our patients safe? For starters, we always want to identify our patients and make sure that they can tell us what their name and date of birth is. So we always want to use at least 2 patient identifiers. Secondly, we want to make sure that the order is complete and correct. So for this purpose, we'll use the first 5 patient rights of medication administration. Let's look at some examples.
Review the 5 patient rights of medication administration in the top right corner and look at the order below. Pause the video and decide whether this is a complete or incomplete order. This is incomplete. The medication is missing the dose. Let's take a look at this order. Identify whether this is complete or incomplete. Pause the video. This order is complete. It has all the components needed to safely give to your patient.
Easy enough to understand now, right? Let's look at other ways that we can avoid medication administration errors. Most hospitals offer the use of barcode medication administration. I will attach it here. This is what this looks like. I'm sure you've seen it around, and if you haven't, please advocate for your hospital to get one. It is super helpful, and there's a lot of evidence that shows that these are very effective in reducing medication errors. But how exactly do they reduce medication errors? Well, you're going to take the scanner and you're going to scan the barcode on your patient's ID band. Once you have scanned your ID band, you're going to scan the medication, and on your computer, in a system that we will talk about in just a second, it should pop up that these 2 are compatible and it is okay to give. Keep in mind that it is your job to triple check if the patient is correct and the medication as well. So what is the system that I'm talking about? It's the electronic medical records, or as some may know it as the electronic health records. EMRs tell us our most up-to-date information about our patients. Typically, when medications are prescribed, it will tell you the drug interactions and food interactions and basically everything else that you need to know for that patient and their drugs. They also include side effects and tests we must do or monitor before and after drug administration. As you can see, these are the most accessible things in the hospital that we have to reduce medication errors. Like the example I gave, it could be because medications look and are packaged the same, or they just sound the same as well. It could also be because of interruptions during the medication administration process, as seen in the video at the beginning.
Hey Haley, your patient in room 355 is asking for help.
Okay.
He says,
Or it could also be due to burnout and unpreparedness. Let's take a look at what would have happened if I actually decided to stick to the 5 first patient rights of medication administration. Hi, Mr. Chicos, how are you feeling?
Better than I did yesterday.
Okay, I'm gonna check your blood glucose again, alright? Alright, you're within normal limits. Just let me know if there's anything else I can do for you, okay?
Okay, thank you.
As you can see, my patient was safe because I was able to identify the right patient, the right medication, dose, route, all given at the right time.
I hope you found this video helpful, and thank you so much for watching.